This is Michael Smith of MedPage Today. I'm in Boston at the annual meeting of the American Association for the Study of Liver Diseases. The cognitive loss associated with minimal hepatic encephalopathy often leads to driving errors, and it may be that drug therapy can reverse those errors. Dr. Jazmohan Bajaj of Virginia Commonwealth University Medical Center and McGuire VA Hospital in Richmond presented data here suggesting just that.
There is a big range of driving impairments, and the way they are diagnosed are also different. You have a simulator impairment that shows approximately 35 to 50% of them may have some impairment compared to controls. And there are studies that have been done in Germany and Japan with actual driving instructors in which a range of 44 to 100% of patients with minimal hepatic encephalopathy were considered by their driving instructors to be unsafe drivers. So they do span a lot of ranges depending on what studies you actually read.
Bajaj and colleagues tested rifaximin, an antibiotic that has very little systemic effect but remains mainly in the bowels, perhaps preventing the root cause of the hepatic disorder.
We believe most of the pathogenesis of hepatic encephalopathy is in the bowels. So what it is hypothesized to do is to reduce the ammonia that is actually the basis of most hepatic encephalopathy pathogenesis. So what we did in this study is we gave some patients with minimal hepatic encephalopathy rifaximin versus placebo in a double-blind placebo-controlled trial, and we followed them for around 2 months, and we found whether their performance on a simulator improved or not. Now, this is very important to realize because rifaximin and other therapies for hepatic encephalopathy have been shown to improve cognitive function. And this cognitive function specifically are things like psychomotor speed, working memory, and visuomotor coordination, which, as you would know, come into play when you're driving. And they all come into play very quickly driving and multiple times. So therefore, it kind of made sense that if you have all these impairments in these specialized tests, that they would also have driving impairment.
The researchers tested patients on a driving simulator, gave them the drug or a placebo for 2 months, and then tested them again, looking for changes on such things as illegal turns, speeding tickets, and collisions.
We found that the drug reduced the total driving errors, which was actually constituted of speeding tickets, illegal turns, and collisions. However, the drug specifically reduced speeding tickets and illegal turns but did not have any effect on collisions.
While collisions might seem to be the most important endpoint, Bajaj argues that the other, more subtle elements of the test are actually more revealing.
The collisions are a part of the outcome in this, but as we have shown in our previous studies, patients with minimal hepatic encephalopathy have very poor insight into their driving skills. So as the simulator is designed, when you make an illegal turn or you have passed the speeding tickets, there is hardly any indication that you have done so. Whereas when you have a collision, everything stops and the patient is forced to realize that they actually have a collision. So it is kind of heartening in a way that patients had insight into their collisions and corrected their behavior almost immediately afterwards for a little time, and then they started continuing to do their speeding tickets and illegal turns. So therefore, in this study, it is not very surprising that the collisions were not affected, whereas the more subtle things, the illegal turns and speeding tickets, which in real life do often lead to collisions, were affected beneficially by this medicine.
The findings are intriguing, but Dr. Bajaj argues that more study with real drivers, real cars, and real instructors are needed before it can be translated to clinical practice. In Boston, I'm Michael Smith, MedPage Today.